everyone, and welcome to another exciting episode of the Nigeria in Focus show, a show where we get to discuss tropical issues affecting the nation. My name is Bukola Adimula, and it's a pleasure to be your host again for today. Our topic for this episode is Public Health in Focus. In this episode, we are going to look at the innovation, the challenges, and the solutions that can be used to better Nigeria healthcare system and the well-being of every Nigerian. With me today are two health experts and individuals passionate about welfare and good health system for every Nigerian. Before we dive into the discussion, I will give my guest the opportunity to introduce himself.
Good day, everyone. My name is Dr. Victor Anyebe. I'm a public health physician and also a clinical researcher. I've worked in Nigeria for over 10 years in public health, in TB, HIV, and malaria. I also currently work in clinical research at the Henry Jackson Foundation Medical Research Institute, where we do some work on HIV and TB, as well as research into emerging and re-emerging infectious diseases. I'm happy to be here.
Thank you so much for joining us, Dr. Victor.
Thank you.
Hello, everyone. My name is Mobu. I'm a graduate of Human Anatomy and Forensic Anthropology, and I also the intern at GlobalShala in affiliation with St. Louis University in the United States. So what we do here is we are in charge of healthcare management to adolescent and also aged people in rural and also urban areas in different parts of the world. Thank you.
Thank you so much for joining us today, Eric Mobu. And let us just go straight into the discussion. I mean, we want to just look at Nigeria public health system. We want to see how far we've come. We want to see the challenges and possible solutions, especially from the view of health experts. Starting with you, Dr. Victor, can you just give us a general view, as someone that has worked in this system for like 10 or over 10 years, of Nigeria public health system? How is it from your own angle?
Thank you very much for this question. So, in response to your question, I would say the public health system in Nigeria is one of mixed fortunes. And I say that because we've had several wins over the last couple of years. We've also had losses. Wins in regards to the way we've handled certain major challenges that have affected our populations, particularly in regards to infectious diseases. For example, you look at how we handled the Ebola challenge, how we handled COVID, and then even how we've handled HIV and tuberculosis up till now, with major improvements in all the indices across these particular diseases. Losses in terms of infrastructure for the public health system. Our hospitals are not the way they're supposed to be in terms of best practices and standards across the world. We're also losing, our workforce. I mean, the recent JAPA trend, which is happening across the country, is affecting our health system in so many ways. So we have fewer personnel to handle very large and increasing populations across the country. And so whenever you discuss healthcare in Nigeria, it's one of mixed fortunes. Also to talk about the fact that we've seen minimal increments in the amount of funding from the government in terms of allocations of budget to healthcare, which has improved remarkably over the years. So, I mean, it's a mix of good fortunes and bad fortunes as well.
Thank you so much for that elaborate answer, Dr. Victor. Eric, what do you have to add to that?
Yeah, I totally agree with Dr. Victor. Just like he said, the issue of we have today in Nigeria, especially for the public health sector, is it's a kind of mix. There's good fortune in it and also a bad fortune in it. I also come to the angle of education. People don't really get the education that are needed to actually help them understand what they should do when it comes to terms of this awareness, how the public sector should run, what is for them, what insurance are they liable to, and what the government is currently doing. Most people are not carried along with this information. So I think that's one area too we have lacked, or that's one area in general I would say we've not really done well in the bad misfortune. Then area of there's increase infrastructure when it comes to funding, right, for the Nigerian populace, and that is really a good thing too. So I totally agree with what Dr. Victor said. That is one area, or generally how we can look at the health sector in Nigeria today.
Okay, thank you so much. Thank you so much for that. It's good for us to just start with how the public health sector is before we go deep into the discussion. And Dr. Victor, as a public health expert, what are the challenges that you think this sector is facing currently?
Okay, the public health sector in Nigeria currently faces quite a lot of challenges. If you begin to discuss that, we wouldn't live here today. So maybe I'll just mention a couple of them. We're faced with emerging emergencies, particularly pandemic threats, which has been recurrent, beginning from the Ebola challenge down to COVID. And so we have to keep battling with those ones and preparing for potential challenges. Prior to those emerging challenges, we already had with us the epidemics of HIV and tuberculosis that affected our populations in large numbers. We also have the protracted issue of maternal mortality and even child mortality, which has affected our populations. In the rural areas predominantly, we have the issues of non-communicable diseases like the hypertension, diabetes, and currently cancers, because we get more exposure to radiation all around us. And then you also have challenges with our infrastructure, from dilapidated hospital structures to insufficient health workforce. All of these things are major challenges for the public health system in Nigeria. And so it affects its ability to respond to challenges, either sudden challenges or even continuous challenges.
Thank you. Thank you so much for that. Do you have something to add?
Yeah, one other area I think we face challenges in is also in the aspect of, this current trend of people don't really getting to understand what it means to be able to give people the right understanding about what they should know when it comes to their health. Right, I always go back to the aspect of education because that is where it starts from. Now, go back to our universities. You see that we lack infrastructures like manpower or those equipment that are necessary to actually build a medical student up to date. So most of them want to really jump out of the country. They really want to go so that they can get these things out there. And another challenge is the point of good hospitals. We don't really have them here in Nigeria. If you see a very good hospital in Nigeria, that means it has to be a private hospital. But back maybe outside of Nigeria or outside of this continent, you get to find a lot of hospitals that are government owned, right? And they are really good. Okay, they are government owned, but they are really good. But here in Nigeria, what you see are basically private hospitals. Most of the times, these bills are unaffordable. So when you go back to the terms of the money aspect, you tend to see that it's a very big challenge we are facing because most people cannot really afford finance that will help them go to the private hospital to get medical care. So what do? The government hospitals are bad. We're still facing this challenge up till today.
I agree with you on that because the truth is the fact that in most of these developed countries, Nigeria is still still developing,
right?
Correct.
So most of these developed countries, the public hospitals are well equipped, and citizens can actually, can access all the benefits that come with it. That just reminds me, there was a particular statement I heard that if Nigerians should, because a lot of these hospitals, investors that are bringing in resources to be able to access, to be able to build this equipment. Someone said that if Nigeria healthcare has these investors, don't you think healthcare will be more expensive for normal citizens?
So that's a very good question. My response to that is the fact that healthcare is expensive, and why you see these challenges in Nigeria's healthcare sector is because more often than not, we rely heavily on government financing of healthcare in Nigeria. Interestingly, I was part of a forum where someone talked about the fact that the initial design for hospitals and health systems should have been approached from a business perspective, where you pay for the quality you want. But here in Nigeria, people want to get quality healthcare at a highly subsidized rate. Understand that the equipment involved are expensive. Understand that the personnel training is also very expensive. And everything that it takes to keep a health center running is very expensive. Laboratory tests are very expensive because you have to have reagents, you have to have those machines calibrated. So I'll give you an example. I can walk into a hospital where they don't have their machines for checking for full blood counts calibrated regularly. And they'll charge me very little for that. But the cost of having those machines calibrated every year is high. So if you want high quality tests, you can trust the results, you're going to pay very highly for that.
Wow.
And sadly in Nigeria, a large chunk of the population, about 95%, pays for healthcare out of pocket. You just have 5% covered by some form of health insurance, either from their employers, So you will understand that when people travel outside this country, they pay heavily for healthcare. So even if investors came in to bring in investments for healthcare, what we currently have called the public-private partnership, which is actually ongoing, you would probably see that the cost of care would go up. I'll give you a good example. If you went to Garki Hospital in Abuja here 10 years ago, you pay less than what you would pay now because they have a public-private partnership that is working. And you would also notice that the quality of service has improved.
Yeah.
So, if truly this is how we can get quality healthcare, or one way we can get quality healthcare, I think there have to be something that will be done about the amount or the way Nigerians live. We really might not be able to afford, or a lot of Nigerians might not be able to afford it.
So my response to that is that there are approaches to improving quality of care or quality of health, as it may be, in a country. And in healthcare, we talk about 3 levels of prevention. Okay. The first level is primary prevention, which means you're carrying out measures to prevent illness. Secondary prevention means that you have the illness and you're trying to treat to prevent complications. And the third level is tertiary prevention, where you're now having to manage complications. Now, in a country that wants to cut down the cost of healthcare while maintaining a certain level of quality, if you infuse a large chunk of your funding into primary prevention, which is where education comes in, which is where helping to create workspaces where they incorporate some form of exercise comes in, you would prevent more people from going into those diseases. Okay. If you help the economies and you prevent people from falling into poverty levels, you also minimize the amount of people who get sick, because poverty and sicknesses or diseases go hand in hand. Exactly.
True. Thank you so much for that answer. Thanks so much. Yeah, Eric, from your angle, what are the ways that you think Nigeria can improve its healthcare infrastructure to make it accessible to people in rural or underdeveloped communities?
Well, many ways the Nigerian system or governments can actually improve its health facility. There are many ways to do that. They can look into, just like what Doctor said, they can look into investing so much in this aspect of it, the primary aspect of it, whereby they educate, right? They create those infrastructures that are necessary to help these people, because if you already have the sickness, you definitely need treatment. But if you don't have it, then you already have the knowledge that helps you prevent getting sick, right? So that's one way. The second way whereby this healthcare can be accessible to people is, getting to give these people healthcare insurance. So as a citizen, I have my NIN number. But these days, just like when you go to the US, you're able to use your tax number, right, to do a lot of stuff. Here in Nigeria, it doesn't apply to us, right? We don't really, the data we have in Nigeria are just used for, I don't know what they are used for though, but if these data are all compared together and I'm a registered citizen in Nigeria, even by birth or by virtue of me coming to stay here in Nigeria, then I should have access to, right? I should have access to facilities of health in terms of hospitals. Okay, there should be a medium of going to, the government you can easily say, okay, all checkups should be free, right? Before even the payment comes in. Like if I just walk into a hospital with my number, with my NIN number, I should be able to access free medical checkup, right? That goes a long way.
Sure.
Because if the government can say, okay, come to the hospital, we're able to give you free medical checkup, I want to go and do it. Then if I know what is wrong with me, I'll be able to, or be willing to pay the cost. But if at the first instant, I'm even looking for money to go and have a just maybe checkup of malaria, as common as that could be, because today if you walk into any hospital, you want to go and check up for malaria, you have to pay heavily, right? You have to pay some amount of money before tests are being run. But these are things that could be provided by government, right? From the taxes we pay, from the health insurance we are being covered for, just like the government say. So I think if this can be put in place, then these measures can help allow those people who are undeserved areas or rural areas to access quality health facilities from their primary healthcare centers.
Thank you.
Maybe just to add to what he has said, so Nigeria is already designed in a way that you have a federal, state, and local government level, and the healthcare systems are also designed in that way. You have tertiary facilities, you have secondary facilities, and primary healthcare centers. Now, the original design, was designed such that you have one PHC per, I think about 5,000 people or so, in a community. So ideally, people have PHCs that are very close to them. And usually this is the first point of accessing healthcare, where basic complaints can be attended to. And then if they can't handle that at that level, then there's some sort of referral up the chain to tertiary levels. But what you see today is you have people who have even malaria or cough going to a secondary facility. That shouldn't be the case. Now, in terms of access, like you talked about, again, we can leverage technology. So I'll give you an example. I worked on a project where we carried mobile trucks with x-rays mounted on them to remote areas to screen people for tuberculosis in their hundreds and thousands. We now have portable digital x-rays that can be packed in a bag and the person trained, and it can go as far as the most remote community in Nigeria and still give people a chance to have x-rays taken. And this has helped us to find lots of tuberculosis cases in remote areas like this. So technology has helped massively to improve access to healthcare. For instance, how people who have apps developed that can allow you to, from the remotest part of Katsina, reach out to a physician who is in Abuja.
Yeah, true.
Probably share your symptoms, and you get expert advice on what to do. If it's something that requires you seeing somebody in person, he makes that recommendation and you take action. So essentially, the world is a global village right now, and so everybody has access to some level of healthcare. The question now becomes, how do you now provide expert healthcare? Because you have a limited number of experts in the country and per field. And so in that case, persons must have to come from those locations to the tertiary facilities to access this level of not just the healthcare, the laboratory tests that would help to achieve diagnosis, and the expert treatment options that are available.
Yeah, thank you so much for that. While we agree with you that technology actually play a role in making healthcare accessible, especially to people in undeserved communities, what about some communities? I mean, we're in Nigeria, doctor. We have the issue of light, we have the issue of network. So what about the people that don't have access to light or network? How will you get to those communities?
That's a good question. So the Nigerian healthcare system is designed such that you have several cadres of health workers, right? You have the doctors, you have the nurses, you also have the community health extension workers and the junior CHUs as well. Now, these guys also work at the PHC level. Some of them have a scope of work that allows them to move around communities. You also have traditional birth attendants and other allied healthcare workers. You have the patent medicine vendors that people go to when they have a complaint. So what we've done in the past couple of years is to bring all these people to the table and discuss and say, if you see something, say something. I mean, we've gone as far as even herbalists to say, if someone comes to you with a certain, symptom that clearly, because we educate them as well, to say, this can be a highly infectious disease. So as opposed to having to begin to treat them for the next 4 or 5 days with your herbal medications, alert us through a well-defined system. We have a disease surveillance system in the country. Alert us if the person has A, B, C symptoms. Then we'll take it from there. We don't mind sending a team to that location. And that's how we've been able to diagnose things like Lassa fever in very remote communities, things like monkeypox. These are all reimagined infectious diseases. Currently, you've heard about diphtheria affecting lots of children. So putting that information out there and making people aware of these conditions, as well as creating systems in place to help with alerting, our response mechanism, has helped to minimize spread of these diseases in some cases. For instance, if you recall, it took 3 days for the Lagos State team to diagnose the Ebola case. Yes. By the time COVID came, it took, I think, about 48 hours or so. So less time. Telling you that our systems have improved in terms of surveillance for these diseases. So yes, we keep looking out for these diseases. And we can only hope for improvements.
Yes, we can. Thank you so much. Thank you so much for that answer, Doctor. Going back to you, Eric, I noticed that you're so passionate about us creating awareness, educating the public. So what are the various ways you think we can actually aim this awareness and, let the public know about public health?
Well, just like Doctor said, there has to be a team in place that reports to the response team. So you can, if we just like let's leave the setting of Abuja, which is an urban area, right? Let's go back to the rural area. Those people who don't really get access to these informations like handy, because these days now you get to talk about network, you get to talk about people don't have access to phones. Not every Nigerian has access to phone, as more as we are using it. There's technology in Nigeria, but not everyone. My grandparents at home don't have access to maybe a mobile phone. Even though they do, they might just be maybe Nokia touchlight, right? Just to make calls, right? To ask, right? So they don't really have access to the internet, right? So, but if there is a team put in place in those rural areas, right, that are helping out to look out to these people, to look out for these diseases, right? That's face the people, they are able to help out to say, okay, this is what is actually plaguing the people. What informations are there that are out there that these people can know? What preventive measures can they take to be put in place so that they will be able to know that, okay, these are the aspects we need to be looking out for when this prevalence is happening. So what they do is that, okay, they go to the experts, right? They get information from them and come back to relate it to the people. I and Doctor were just talking before we got in here that if the elders in the village are able to do this, they stand as the mediator between them and the experts. So they're able to get information from the people, know what is plaguing the people, know what kind of medical assistance these people need from those rural areas, communicate it with the experts so that those teams can come in to give. So it's just like you doing a background check. What do they really want? Is it malaria that is prevalent? Is it Ebola that is prevalent? Is it tuberculosis that is prevalent in a particular community? So it's like you conducting a survey, then you bring in the information that are needed to prevent what is happening. But if you don't really know what is happening in the society, you get to understand that today you might be treating one particular thing, because most of the people, like recently I got a case that most of the people that have been going to a chemist store, all of them go to ask the doctor to give them malaria drugs.
Yes.
Now that's because they just feel unwell and they just go, doctor, I need the malaria drugs, without even knowing what is wrong with them. But if we are able to conduct a survey that helps understand that, okay, this community is not just being sick of malaria, there are other diseases around this community. It is able to give them the right kind of information that help them stay well. The preventive measure that works for malaria might not work for tuberculosis. So how do we now educate them? We have to get information, raw facts from these persons, because they're the ones that are sick. So how do the experts now know what kind of information will benefit them? It's having to get this data, analyze them, and then push them to the experts so that they can get information that helps the populace of that environment understand that, okay, this is what you need to do for you to be prevented of this kind of disease, for that kind of disease. And I think that will go a long way to help curb this menace we face.
Yeah, thank you so much. I think you're trying to say there needs to be like a partnership between the community and the
the healthcare system. Yes.
For that is like your to create more awareness about the particular health system. I think that's a good one. Thank you so much for that contribution, Eric. To an extent, I think there's kind of like a disconnection between people in rural place and the health experts. When you explain, I just understand the fact that actually the elders, as you said, can be the bridge to form the community or the people in the community to the health experts. And that way, this public health awareness, this campaign, whatever you want to give to them, you can just easily use it through them. But I noticed that sometimes those particular, I don't know, maybe you've witnessed in one of your hatcheries, these elders, this community elders, they kind of just ask for some money at times before they want to partner with.
So basically, in delivering healthcare interventions to communities, you must bring these elders to the table. We call them community gatekeepers. So what it means is that if they don't have a buy-in, then nobody accepts your intervention, because these people are held in high esteem by the locals in that community. And they're mostly sometimes more elite, so they understand, information better. So when you engage with them, you let them see the benefits of your intervention. And then more often than not, you want somebody who is local to lead in that campaign. So the people see them as one of theirs, and then it makes it easier for them to accept. Now, I'll give you an example. I've carried out several campaigns to find TB cases across the country, in the north, in the middle belt, and even in the south. And one of the first things we do is what we call community entry. So we identify the key stakeholders in the community. It could be church elders, it could be the local government, or you go to the government and the government invites these elders. I mean, there were times I had to even crawl on my knees and go into a palace because that is how they access the palace. Or take my shoes off and go into a mosque to sit with the imam, because the imam's word is power. So once you get him to buy into your intervention, it makes it easier for them to spread the information around. And just like you were saying, people may not have phones, but I tell you, in these local communities, if you go to the north, an average houseman has his radio.
Of course.
Even those in the farms. So what happens is they keep listening to programs every now and then. And that's why you have many stations airing health programs that are delivered in the local dialect of these communities. So when you come, you're not new to them. I was telling him earlier on, you have two groups of people. You have those who have never heard about this issue before, and you have those who have heard but have a misconception about it. So you must go there with two strategies. One, to break down the misconceptions about the issues, address it, and then have them welcome your initiative. And for those who have never heard about it before, you want to educate them afresh, and that's how you get your buy-in. So yes, sometimes they can pose a challenge in asking for some sort of financial, benefits. But I think that if you follow the right channels, like I said, through the government to them, it minimizes those kinds of occurrences.
Sure.
Okay. Thank you so much. I'm coming back again to you, Dr. Victor. During the last question I asked you, mentioned that Nigeria has improved when it comes to cases of emergency emergency disease
response.
Response. So, what lesson do you think Nigeria healthcare sector have learned in our Ebola and COVID state? For me, sincerely, I think the Ebola intervention was actually more, maybe because
it was luck.
Yeah, no, not luck. I wouldn't say luck per se, doctor. Okay. I would say I think it was more effective. I mean, it curbed it, unlike maybe because of the kind of virus and the mode of transmission. Maybe unlike the COVID that
took a while.
It took a while, and it's still it's still currently in the country. So, what lesson do you think the sector, and how do you think Nigeria is preparing for this kind of emergency cases?
Okay, thank you for that question. So let's still use the Lagos case scenario, yeah? So Lagos had the Ebola virus disease case in 2014, I think sometime around April. And like I said, the Lagos State Health team swung into action, and that case was diagnosed within 3 days. The person was put in isolation, and then they put in place contact tracing mechanisms to trace people who had come in contact with the primary patient. That case served as the basis for a lot of policy changes and strategizing towards addressing emergencies like that. And as we speak today, we have what we call emergency operation centers in about 20 states, stemming from what happened in 2014 down to the COVID pandemic in 2019 up till now. Some of these things have also been easy to set up because Nigeria has proud to now battled with infectious diseases like HIV and tuberculosis. And we've had vertical programs funded by donors like the USAID, the CDC, that have put in place structures at the federal, state, and even local community levels for quickly notifying, the system on diseases. And so currently the country is positioned to quickly identify any potential pandemic threats. I know that COVID may have still spread despite our interventions because, as opposed to the Ebola virus, which is blood-borne mostly, COVID at some point, they had discussions about whether it was airborne or a droplet infection, but the spread is a lot faster than what you have with Ebola, because with Ebola you have to have direct contact. With COVID, if the person is in this room and we're all here and we spend a reasonable amount of time then our chances of getting infected is higher.
Higher.
So, I mean, both viruses have different aggressions and different mechanisms of transmission, But essentially, the point is that we have learned our lessons and we have improved in terms of our surveillance. In fact, we now have a very active NCDC, that's the Nigerian Center for Disease Control, which is at the forefront of actively surveilling for disease, responding and preventing spread. So in Nigeria, you have an integrated disease surveillance response system that ensures that once there is some sort of threat anywhere, before it maybe escalates, there is effort to contain it within that locality. So you have lots of trainings going on. I took part in the training on monkeypox in Lagos, where we're trained even on infection prevention control, on how to determine case definitions for these diseases. So there's a lot going on, and not just by the federal government, but also by international partners. So you have lots of stakeholders. Like I said, everybody has to be involved. So the churches are also involved. They are trained. Community members are also trained on how to identify some of these diseases. And then you have ongoing awareness creation by radio programs, jingles, So we're part of the global pandemic preparedness system as well. So once you hear about something in a country, for instance, then you know that every passenger coming from that country has to be sort of screened, So as part of the Emergency Operations Center, there are several components. Part of it has to do with port health. So your airports, your ports, they have ongoing screening. Part of it has to do with community mobilization and sensitization about that disease, so that in case somebody slips through the cracks, maybe a relative can say, "Oh, my brother just came in from India, and I'm seeing blood," and, so quickly they pick it up, So we have the research component as well. So many components, so the supply chain and logistics to ensure that vaccines or drugs get to that location as fast as possible. So a lot of things are in place. People are trained in those sub-units to respond to emergencies in the country.
Thank you so much for that answer, Dr. Victor. I mean, hearing from you, I think Nigeria is actually improving when it comes to providing quality healthcare for its citizens.
Mixed fortunes.
Because I didn't know before that we have this lot of we have 20 response center.
Yes, across 20 states in the country. And I think that it's probably going to increase with time.
That's
so
a big one.
Nigeria is not always bad news. I mean, I've heard people in Canada and even the UK say they are waiting for months to see a specialist.
That's true.
So I mean, we have some good news here as well.
Yeah, we have some good stories, and it's good for us to always bring these stories and innovation to encourage that the government or Nigeria is actually doing well. Thank you so much. Eric, from your angle, how do you think Nigeria is progressing in respect to providing quality or health insurance to its citizens? Do you think we are doing well? Do you think we should do better? What do you think the government should do better to provide health insurance?
Well, to a point, I think Nigeria has done well when it comes to health insurance for its citizens in terms of the NHIE, which is currently on. But then that is like one part of the global goal of helping citizens to actually access healthcare. So I think what could be done better is, well, just like they said, just like Dr. said from the beginning, right? Healthcare is expensive. So even the government is paying so much to make sure citizens can afford this. Okay, so I think for me, what can be done better is they should just continue. There should be a maintenance culture that goes on, because most of the time you see that people that have had access to healthcare insurance 2 years ago don't have it again. Maybe because they lose their current job, or maybe because they passed a certain age. That shouldn't be. If there's a health insurance, then it should cover not just a large part of your healthcare, but it should cover at least maybe 50% of your healthcare as a citizen of this country. So not just looking at it that from 0 to 18 years, that's when you're being covered for. Why not 0 to you're dead? So we can look into that aspect. Yes, we can look into that aspect. It's possible because we get funding for these things. So it's possible if the government can say, okay, we are all in for this, and they want to do it, not just saying, okay, we want to do it based on a particular, maybe a time frame, right? If it's all out, then it should be all out. Not just looking at it that from 0 to 18 years, you're being covered for, and you have to, some persons have to register. I'm not covered by NHIA, maybe because I did not register for it, right? But those who are covered for, like, okay, just like the 1 year National Youth Service,
Yes.
that's the only time as a citizen, maybe basically you're being covered for that 1 year. And most times it's not even effective because I spent all my 1 year looking for my healthcare center, like where I was enrolled for NHIA as a youth serving member, right? So I think we can improve. The government have this data. I just feel they have a problem of looking into the data and know what to do with it. So if they can look into this data again, the data of what we have, then look into it and see ways they can come up with better solutions in helping the citizens get healthcare insurance, not just because maybe you're serving the government parastatal, or maybe you're from 0 to 8 years, or you're born in a hospital that covers your healthcare insurance, but looking all out for the citizens, right? If you're born in this country and you have a NIN, right, the national identification number, then you should be able to have access to healthcare insurance by one way or the other. So I think that will go a long way to help in promoting that.
Maybe just to add to what you've said, so the government is making efforts. I think everyone has been happy that the last budget saw a remarkable increase in the allocation to health.
Yes.
I think for the first time, Nigeria had money sent to healthcare over 1 trillion. You know, but even at that is still less than the commitment made at the Abuja Declaration by heads of African governments to allocate 15% of budget to unallocated to healthcare. We're just about 5.75% with this amount. But with that, more money has been, put into the health insurance scheme. And then we also had the National Health Insurance Act passed, I think, last year, which is, a step in the right direction. The question now is how to find the financing for this. Because like I said earlier, just about 5% of people are covered by health insurance in Nigeria. The rest pay out of pocket.
Yeah.
I did some work in San Francisco where the city of San Francisco had a pocket of funds called Healthy San Francisco, which was healthcare for the jobless or the homeless. So that was people who didn't have jobs, but they could still access basic, healthcare services essentially. So I think the country also needs to look outside and look at other countries, look at best practices, and also find partners who are willing to, partner and supporting health insurance. Because it goes a long way in helping your citizenry in terms of accessing healthcare services.
Healthcare system. Just to add to what Dr. Victor and Eric said about the NYC. I remember in NYC, maybe you were unable to find your center because I know somebody that actually accessed that NYC.
Okay. Yeah,
and she really used it very well because then even she was battling with some medical this thing, and it was easier for her to go there, and she did pay. But I didn't use mine. I told myself maybe I should have
health insurance works.
Maybe I should use it to, maybe change my glasses or something.
It works. Just like it may not cover every type of ailment,
yes.
But for basic ailments, it works.
It works, man. Thank you so much. So, what measure do you think have been put in place to combat diseases like malaria, HIV, tuberculosis, just as you mentioned at the beginning?
Quite a lot is going on. So, you talked about 3 different diseases. So, let me start with malaria. So for malaria, we have currently the U.S. Presidential Malaria Initiative, PMI, which has been supporting the country for probably up to 8 years or more in Nigeria. And they've been supporting in terms of increasing numbers of insecticide-treated nets available to communities and children under 5s, access to rapid diagnostic tests, that's testing for malaria, because you have to test before you can treat, and providing treatment as well. And I'm sure you're also aware there's been efforts to carry out research to find vaccines for malaria. So these are all efforts to see how we can reduce the prevalence of malaria in Nigeria. Moving to HIV, a lot of work has been done. We had the recent NICE survey, which showed that Nigeria had a lower prevalence than we actually thought was there. And we've been working so hard to ensure that everyone who has HIV is placed on treatment and achieves viral suppression. I think at the last check, the country was already on its way to over 85% of viral suppression. And you know that what that means is that all those who are suppressed virally cannot transmit. So there's this popular saying that undetectable means, untransmittable. So that is probably what is going on with HIV right now. So everyone is giving access to testing. In fact, we're now looking at self-testing. For people who don't want to go to a health facility, you can do self-testing.
Yes.
So you have self-testing kits, across the country in several pharmacies as well. For tuberculosis, there's been a lot of effort by, of course, non-profit organizations, CSOs, CBOs at community levels, actively finding TB cases. So we find the case, we treat them immediately. And a lot is good. I told you about the mobile X-ray platforms that can now go to villages and then screen for TB. So we're not even waiting for you to come and cough. We're going out to communities and saying, everyone come in here and let's do an X-ray for you. If we see signs that it might be tuberculosis, we want to quickly test and then maybe give treatment, So we're also having innovations like using stool samples to test for TB. It wasn't the case before. Because, for children, even when they cough, they swallow the sputum. So it was hard to test children. But right now, we now use stool samples to test for tuberculosis, which is a great innovation, and is helping to increase TB case finding in the pediatric population. So a lot of work is going on. I know that there's work going on right now to even do TB testing using breath tests. So there's quite a lot of innovation in these spaces to see how we can improve, first, access to diagnosis by testing, and then access to treatment, or drugs,
That's quite a lot going on in the healthcare sector. Thank you so much for that answer.
You're welcome.
I was doing a research some months ago, I think last year though, and I found out that the research shows that for one doctor, we have about 100 citizens. It was a research on the shortage of medical personnel that we have in Nigeria. And knowing the fact that, was it not last year or early this year that the House
was trying to pass
a bill to stop healthcare workers from jackpotting in quotes outside of the country? Was it this year or early last?
Yeah, it was this year.
Early this year. So, from your angle, Eric, what do you think can be done to, I do not support that passing of bill for my own angle to stop healthcare workers from jackpotting abroad. But from your angle, we were over 200 citizens and truly our medical personnel are really been reducing. A lot of UKs are taking our medical doctors away. What do you think can be done to, make the healthcare system more enticing for someone like Dr. Victor to stay in Nigeria with us?
well, just like Dr. Victor, like we're just discussing this outside before we came in. It takes passion, right, to actually do it. What you see abroad is a test, just like he was saying. They have a finished work there. So these guys are just going there just because of the money. If you make them comfortable in Nigeria, they will stay. If you make them uncomfortable in Nigeria, they will leave. So the point is, what is the government doing? Just recently, doctors were on strike, right? In Cross River State, I don't know about maybe the whole federation, but they were on strike. Why? Because of what they are getting is not equivalent, or it's not even up to the time they are putting into their practice. So how do you go to a hospital? Most doctors don't even have a space called their own office. Where do they stay to work? You're not paying them well. Doctors don't have access to comfortable homes. How do you want them to even carry out research? How do you want them to wake up every morning and go to that job? So if you make them, one aspect I will give is, if you make them comfortable, they will stay. But if they're uncomfortable, they will definitely leave to go to a better environment where they feel they have good pay, they have access to good light, they have access to good road, they have access to good housing and all of this, even though they pay highly there, but they're still comfortable. Right? The hospitals they work in, they are comfortable. They are good hospitals, right? But here in Nigeria, with even with the bad infrastructure we are seeing in terms of our hospital spaces, you're treating somebody for malaria. But do you know that you still go to hospitals, even in Abuja here, sleep in some hospitals, mosquito will still bite you.
You could take malaria out of there.
Do you understand? So that is the point. Our infrastructures are poor, okay, when it comes to what we have or what we have put in place. So imagine a healthcare practitioner who is not even healthy himself to take care of another person who is not healthy, right? So you have to make the place conducive and comfortable for them to live in. Not just speaking about the healthcare profession, we have to look into different aspects, even in education. Most lecturers too today, the next one will be hearing not just healthcare practitioners, but lecturers leaving the country to lecture abroad. It's even happening. So
Thank you so much.
Okay, maybe I like what you said about the fact that if you make the doctor comfortable, or it has to be healthy before it provides health to somebody else, right? Well, my perspective to this or to that attempt to make a law to stop doctors from leaving the country is that it's the wrong approach. It's a good intention, but applying a wrong approach. So it's like you're cutting the branch instead of addressing it from the roots. You know. So again, people think that more often than not it's the remuneration that is the motivating factor. But I'd like to say this clearly that deciding to practice in Nigeria or not goes beyond just remuneration. You know, work environment is also another motivation. So as a physician, I want to be able to have everything I need to properly diagnose a patient and provide correct care, correct and suitable care, not temporary care. You know, so if I have to keep getting calls from a patient every night because I couldn't give him the complete approach to treatment, I won't be happy. So beyond the remuneration, the doctor also wants to see that what he needs, the environment he needs to provide the best quality of care is in place. Secondly, I want to get better at my profession. I want to be doing things at the level that is happening in the US, in Saudi Arabia, in the UK or Canada. But when I go into forums where people are discussing medicine and I can't discuss that because I'm limited by my environment, then it's a challenge. I'll give you an example. My younger brother was doing residency in radiology in Nigeria. And for about a year, for somebody who is supposed to become a radiology specialist, his center did not have a functioning CT scan.
Wow.
Which is supposed to be a basic diagnostic tool that somebody in that specialty uses. Imagine training a radiologist who will now finish and say he's an expert, but he has had little or no contact with the CT scan. How does it compare with his counterpart elsewhere? So beyond remuneration, these guys want to really be the best. Nigerians always love to be the best. So there's the remuneration component of it. There's a training and facility component of it. The other part again is this. The physician, just like any other person, wants his family to get the best out there. You know, so beyond just himself, he's also looking out for his next generation. You know, and again, we now live in a globalized society. The world is now global, which means that, like I said earlier on, medicine and healthcare is a business and must be handled as a business. So in a business, the biggest payers will always run after the biggest or the best hands. So if I think that somebody can pay more for my services, I would look for it. You understand? So what the government needs to do is, like you said, put in place measures that provide the best environments, the best motivations in terms of remuneration and support for these doctors. If a doctor is given, you know, a house in Abuja, allowed to pay over the next 10, 15 years, he will stay. He would stay.
That's true.
So there's lots of ways to approach this motivation. I mean, you know, you think those guys are always very happy living out there in the UK? They're not. I can tell you that most doctors in the UK have their ears listening to news about Nigeria every day, even more than you and I. And they're always hoping that things would improve here so they can come back. So that's it.
Thank you so much for that, Doctor. I always approach it from the angle of Eric also that, maybe just increase the salary of healthcare, then maybe they will stay. But hearing from you that it's more than even that for doctors.
Yes, more than.
It's really enlightening. And I remember the story of that Lagos State intern that fell from elevator. Did she fall from elevator or the elevator fell down?
The elevator fell with her inside.
With her inside. I mean, these are things that doctors experience. Just a few days ago, also, I read that a young doctor slumped and died. These are, I mean, why?
So as people are leaving, the burden of work is increasing on the few who are around.
On the few who are there.
And you know, like in the West, people work shifts. Even doctors work shifts. Here, doctors work literally all around the clock.
True.
You know, and that is not, I mean, ideal.
Not ideal. It's not ideal. In as much as we say doctors too can vote for them to, care first for the life of citizens. We should also remember that they are also humans and they also have lives. Thank you so much for staying with us up to now. Before we officially close this episode, I just have one question for my two guests, and then we'll call it a day. Starting with you, Eric, what are the policy you want this new administration to, put in place? Just give me one or two policy from your angle that you want this new administration to put in place to ensure quality and improve healthcare facility for young Nigerians.
Okay, so I think one of the policies I think can be put in place is basically getting to get a kind of feedback, right? So government should know what is actually happening in rural areas for them to be able to provide better assistance to them. So we all have data analysis is one of the biggest shots today. So government could invest so much in this aspect to get data from communities, rural communities, right? To be able to say, okay, this is what is happening in the populace of Nigeria, like this was happening in this state, this was happening in this place, this was happening in this place, and they're able to attend to them based on their needs. Because if you just just like Doctor said, the 1 trillion that was pumped into the health sector, the next question is, what will this money be used for? What will it be used for? Is it data that have been kept for over the past 10 years? Or data we are getting from now? How will they appropriate these funds? Is it going to be appropriated well? Or there'll still be mismanagement of these funds? Because I bet you the Nigeria we live in, we might still get mismanagement of this fund if we don't really get what is needed, like going back to get data from the communities and know what they actually need. Do they need mosquito nets? Is that what they really need? What do they actually need to live better lives in their society or in their community? So that will really go a long way to form policies that will help us reach out to those people in undeserved communities or rural communities to better their lives.
Thank you so much for that. And from your angle, quickly, Doctor, what are the policies you think this new administration should put in place to improve healthcare for every Nigerian?
So in all honesty, my response to that question is Nigeria has so many already well-established policies that we haven't even implemented fully. So I think that we should even begin with implementing the already existing policies. I'm happy that we have someone like Professor Ali Pate in government, who is someone who has been in the development space and has seen best practices. I'm hoping that he can drive implementation, because if truly we implement what is already on ground, we'll see marked improvements. But at the same time, just to add, to what's already on ground, I expect to see that we have more data-driven decision-making at every level of healthcare governance. Money must be used to make decisions on products to buy, equipment to buy, priority diseases based on available data. Then more effort must be put into training of several levels of healthcare workers, focusing mostly on the local communities. The JHUs and the CHUs must be equipped properly to handle many of these basic diseases, so that we cut down the number of people who are coming to secondary health centers with some of those basic illnesses. Equip them and improve their health facilities. And you will redirect traffic to those centers. And then for the healthcare worker, improve the work environment for them and the work conditions, and they'll give their best, essentially.
True. Thank you so much. Thank you so much for staying with us up to now. To our online audience, thank you so much for staying. And to our two guests, thank you so much, Dr. Victor, for your contribution. Thank you so much, Eric Mobu, for coming to join us on this conversation. We will have come to the end of this episode. I hope you were able to learn one or two things about healthcare system or the public healthcare system in Nigeria and the different innovations that the government and even international communities are doing or to ensure that we have quality healthcare in the country. Until next time, have a wonderful day. Bye.